To fall. Joining us now on the New Normal to break down all things COVID-19 is Dr. Charles Bruce-Tagoe, the Fairfield Regional Medical Director at Hartford Healthcare St. Vincent's Medical Center. Doctor, thank you for being here. Let's talk about that CDC guidance, or really lack thereof, right now. Bottom line, holidays are right around the corner. So from your perspective, what are the big do's and don'ts for those who are vaccinated and those who are not?
So for those who are vaccinated, it's good news. You can get together with other vaccinated people. Obviously, the common sense precautions will be make sure you wash your hands. If you don't feel well or feel under the weather, you want to stay away from the groups that you would love to meet up with. For those who are unvaccinated, there's still time. There's still a lot of time left for you to get vaccinated prior to. If you're unvaccinated, then the precautions might be make sure you keep a little bit of distance, keep your mask on, make sure you keep your hands washed like you were told, we've all been encouraged to do all year long, or nearly 2 years since the pandemic started. And that should make everybody healthy, and so we can enjoy a long and beautiful holiday season.
As you point out, there's still time for the unvaccinated to get vaccinated before the holidays. I wonder if we'll see an increase just based on that alone and trying to fit into those plans. But let's talk about another topic here, Doctor. Booster shots. Are they something to be considered before attending any gatherings? We know they're being recommended for certain groups like seniors and those with certain conditions as well.
Absolutely. I strongly recommend you take your booster shot if you do qualify, if you meet the criteria. Currently, we have Pfizer has been the only one that's so far been approved for booster shots. If you're over 65, if you're a frontline worker, if you're an at-risk person, if you're immunocompromised, strongly recommend that you do take the booster shot. So if you do qualify 6 months after your last Pfizer, and you're contemplating, especially if you're contemplating going into to meet friends and family, definitely get a booster shot. And even if you're not, the current recommendation is do get it, and that makes you safer.
All right, Doctor. Well, there are some new developments today in the push for COVID-19 booster shots. Johnson & Johnson has now submitted data for its second dose. It's asking the FDA to approve those shots. Now, J&J hasn't detailed when those doses would be given just yet, but the FDA is expected to review that data next week. So, Doctor, do you think we're looking at approval for this shot, and how much of a difference will it make for those who received what they thought was the one-and-done J&J shot, only now to potentially require a booster as well?
So a lot of people may be disappointed. They got a J&J, one and done. They don't want to have any more needles. But we do know that this virus keeps mutating, and we're getting several variants. And that makes it likely that what we took initially and we thought would be well protected, we may not be getting as much protection as we had hoped. So thankfully, and we hope there's the science pans out, the literature pans out and supports the need for it. If it is approved, I'll strongly recommend that everybody take it. Those of us who took Johnson & Johnson and are at risk are looking forward to it, and I strongly therefore recommend that we do take the booster. Even though we may be disappointed, it's just going to be a second shot. Other shots have been twice already, so those getting the booster are getting their third shot. So if you took a Johnson & Johnson, it's just going to be the second shot for you, and hopefully that should give us, keep us on the long haul for the journey.
And we know that the FDA is also reviewing information about a possible Moderna booster as well. Let's talk more about boosters and specifically new data regarding Pfizer's coronavirus vaccine, Doctor. The study published in the Lancet Medical Journal shows Pfizer's vaccine is 90% effective preventing hospitalization and death at least 6 months after the second dose. However, the vaccine's ability to prevent infection was essentially cut in half. So, Doctor, this is the data the FDA looked at when deciding whether booster shots of Pfizer's vaccine were needed. What's the big takeaway here? What do we tell viewers who received the Pfizer vaccine, got 2 shots, and are now wondering, do I need that third?
So what I say is, thank God we have a vaccine. Here's the deal. If you didn't have the vaccine and you came down with this infection, COVID, you could be hospitalized, being seriously ill, or even lose your life. With the vaccine, even if it's half as effective as we had hoped it would be, it's preventing death and preventing hospitalization. That's a one-up on this virus. That's an advantage in the fight against this virus. So I strongly recommend that you do take the shot. Do not be disappointed that it's half as strong as you thought it would be or half as efficacious as you expected it to be. But think about the positives. It's preventing death and preventing hospitalization. Currently in the country, up to about a couple of weeks ago, 9 out of 10 people, or nearly 9 out of 10 people who were dying from not being vaccinated. Nearly 8 out of 10 people who were in hospital were people who were unvaccinated. Only about 1% of people who got in the hospital, that's 1 out of 10, were vaccinated prior to getting the infection and end up in the hospital. That is strongly positive. And I strongly recommend that people look at that versus looking at the numbers. And the numbers are the numbers, but look at the facts on the ground. It protects you, keeps you from dying, keeps you from ending up in the hospital or being seriously ill, and therefore it's very good.
And doctor, as you point out, even you look at seniors and you see stats, 39,000 seniors, lives saved between January and May of this year thanks to the vaccine. So more good information there as it comes to the work vaccines have done to help save lives and stop the spread. Doctor, thank you so much for joining us.
Thank you for having me.
Well, tonight we're hearing from you, the viewers, about whether masks in schools should become a thing of the past. Plus, a look at a new at-home test kit for COVID-19. Does it actually work? But first, remember to vote in tonight's News 12 Twitter poll, and we'll be right back.